Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a custom content strategist here at Modern Healthcare. On today's episode, it's my pleasure to be speaking with Kim Cantrell, Director of 360 Care Management at Wise Health System, a 4-hospital integrated care network located in North Central Texas. In her role, Kim leads Wise Health System's hospital at home program. With over 200 beds and more than 2,000 employees, Wise Health recently launched their hospital at home program as part of its progressive healthcare delivery philosophy. Kim has over 30 years of experience and is a certified case manager and registered nurse. Before we dive in, I'd like to thank the sponsor of this one-on-one episode, Bioformus. Bioformus is a global leader in providing advanced technology and clinical support for care at home and digital therapies. Bioformus is driven by a passion to enable providers to personalize care and enable better outcomes with lower costs across the entire care continuum. Kim, thanks so much for being here today. I'm really looking forward to our discussion.
Thank you. I appreciate it. I'm glad to be here as well.
Alrighty, so let's dive in. So today you and I are going to be talking about Wise Health System's remote patient monitoring program and the positive impact it's having on your patient community, particularly the rural population. So let's dive in. When Wise Health was initially considering the remote patient monitoring program, what challenges was your team looking to solve?
When we initially started with remote patient monitoring, it was right after we received the CMS waiver for the acute hospital care at home. And so it was during the midst of COVID, and we had very crowded bed space. So we were really looking to open up some bed space so that we could take patients home and through the hospital at home program, and the more acutely ill could be in the brick and mortar facility. So that was really our main goal in starting with the RPM and the hospital at home program.
Okay, great. All right, so let's talk about what it is like now. So for the rural population that Wise Health serves, is patient access to care a significant issue? And then how is your remote care at home program helping to address that challenge, rural populations and access to care?
Certainly. I think it's always a challenge when you live in a rural area. We don't have an infrastructure for bus systems or a big taxi service or any of that. So it's hard for patients to get to where they need to be sometimes to get care. So providing remote patient monitoring really lets us see the patient at home in real time and know what's going on with that patient, even if they're not able to get into the physician's office, or if they're not in the bed in the hospital, we can see them at their bed and home and still know what's going on with them and have a really good sense of how they're doing and if they're doing well or if we need to intervene in some way. So it's been really paramount in helping in a rural area when there is a real lack of access to healthcare, for us to be able to provide this in their homes. It just kind of branches out where access is available instead of it just being one facility. It's all over the county.
Right. Okay, wonderful. So obviously this is a lot to do for a health system. So when you're considering a partner to provide a remote care solution, what are the key features and services that you're looking for?
Well, really, I think the number one thing is that you have a true partner, somebody that's willing to walk along beside you and really work on any problems that come up. With everything, there's always, problems or little glitches that have to be worked out, but you really need someone that's going to be hand in hand with you in building that infrastructure to make sure that it works. Being in a rural area, we have limited access to things like cell towers and Wi-Fi, where in the city, almost everybody has that. Out here, we have a lot of patients that don't have that. So it was really important to have remote patient monitoring that would be able to function even without all of the Wi-Fi access and things that are typically found in city populations. So it was important to find somebody that had the capability to work within those restraints and still be successful.
Right. Definitely sounds like reliability is really important.
It is.
All right, so there are a lot of stakeholders to consider when you're starting a remote care at home program. There's the clinicians, there's the patients. So since deploying, what feedback have you received from both of those stakeholders, the clinicians and the patients?
We've not received anything but positive feedback. We have been going a little over a year now with patients in the service and in the program, and we've had so many patients write wonderful letters about how this is where they want to be. They want to be at home. They want to be able to stay home even when they're sick, and that they feel like they healed easier, they healed better, they healed faster. And we've had great success in preventing things like readmissions. We have been successful so far that none of our hospital at home patients have had to be readmitted within 30 days of hospitalization, which is really huge because that's a number that's really hard to reach. So the fact that we've been able to keep them out of the hospital once we've brought them home has been really something that the patients have loved. And our clinicians, at first they were really hesitant about the program because, how can you watch a patient when they're at home? And, once we were able to show them, look, this is what the dashboard looks like. And you can see what their heart rate is. You can see what their oxygen saturation is. You can, real time, what's going on with this patient. And once we could show that to them, it made so much more buy-in from the physicians and the clinicians that they felt comfortable with them being in a home environment when they knew they could actually see what was going on with that patient. You didn't have to just wonder, is this patient okay? So that made a big difference in both the clinicians and the patients being comfortable and feeling safe at home. I think it gave them a safety net that we wouldn't have without the remote patient monitoring in place.
That's a really great point, Kim, about showing the clinicians, okay, this is the data to back up what we're doing and the positive impact it's having on patients to get that buy-in. So really great point. So let's dive into a patient story. So can you tell us about a patient that exemplifies the kind of impact your remote care at home program is making?
Yes, I have so many good patient stories, but I think one that's really stuck with me is, as I said, when we first started, it was during COVID, so patients were really isolated in the hospital. They didn't have their families with them. We had one gentleman that had been in the hospital previously and he had some dementia and a lot of sundowners, so he got very confused at nighttime. Ended up at one point having to be restrained when he was in the hospital the first time. So when he came back to the hospital sick again, his daughter was like, I don't want to see him go through this. I can't be with him. He gets confused if I'm not with him. So we were able to take him home with hospital at home, and the daughter was able to stay with him. He didn't have the sundowners that he had inside the facility. He was able to successfully be treated at home. And, his daughter was so just appreciative of that program that, she was able to stay with her dad. She was able to care for her dad, and he was able to get better without having to go through the confusion and the delirium that comes with sometimes hospitalization, especially with older adults. And so it just made a huge difference. And, anytime he would come back, that was the first thing to say, can we have our hospital at home? Can we have them back? Because it made a big difference for them in their personal lives that he was able to get better and be healed when he was still at home.
Yeah, and that story is so great because it also shows the impact that it's having on these families, right? Mm-hmm. That act as the caregivers for their loved ones, the relief that it provides, that they're able to stay at home and heal there.
Yes.
Okay, so let's talk about what's next for WISE's remote care at home program. Have you expanded beyond just the acute care population?
We are in the process of that right now. We actually have a go live date this week, so we're very excited. We're adding remote patient monitoring to our chronic care management team here within the 360 program, where we follow the patients that are discharged from the hospital for 30 days after hospitalization to try to prevent readmissions. And those patients will now start going home with the Bioformis platform and the remote patient monitoring so that we can, see real time on them. When are they having an issue? sometimes they don't even realize that there's a small thing changing with them, but we can see it with this remote patient monitoring and intervene more quickly, so that it'll prevent them from having to come back into the emergency room or coming back into the hospital. So we're really, really excited about rolling out our remote patient monitoring for our chronic care management patients as well. So
Great.
Yeah.
All right. And so to close out, let's talk about when you're considering a remote care at home initiative, what advice would you give other hospitals and health systems leaders that might be watching this?
I think it is a phenomenal program. I think everybody should look at doing this. I just think it meets the needs that our patients have that we haven't been able to meet in the past. So, but just be ready for a lot of education for stakeholders. It really takes a lot of education and re-education on what the program is, how it can work, how it can be successful. Having the remote patient monitoring system in place, just like I said, it gives that safety net to the patient and to the providers, so that they feel like the patient can safely be managed at home. And use that dashboard, use the information you can gain from the RPM to show these providers the benefit of this program, because that's really one of the selling points for making this a successful program.
That's great. All right, so that brings us to the end of our discussion. Thank you so much for speaking with me today, Kim. This was such an interesting conversation and such an important topic, like I was saying, at this time, as I know our audience is considering these remote care at home programs and expanding their programs. So thank you so much for your insights.
Thank you. I appreciate being here.
And to our audience, thanks for tuning in today. For more information about the sponsor of today's episode, Bioformus, please visit bioformus.com and look for more one-on-one episodes in the coming weeks by visiting our website and our social media platforms. Thank you.